All right, so I'm going to start chatting. So we're going to talk about three factors that I think are really, really important to watch for, whether you're a coach, you're a parent, or you're the athlete yourself. So I know my content can get pretty heady and pretty sciencey. This is not a talk for clinicians. This is a talk for the parents, the coaches, the athletes who are in the situation where they're trying to return to play or want to get the athlete back onto the ice, the field, the court, whatever. Here are three factors that I think are really, really important. And I think when you account for these things, a 7-day return to play just simply wouldn't happen. And when people hear that a normal concussion recovery takes 21 days, like this happened just this week with a patient, normal concussion recovery takes around 21 days, athletes and almost especially the parents of the athletes kind of groan and they're like, oh, like 21 days. Oh my God. And it's like, name another sports injury that recovers faster than 21 days. I'll wait, right? Like an actual sports injury that lasts 21 days or shorter, that's a pretty quick injury. The only thing comparable to that is probably an ankle sprain. An ankle sprain and concussion recover about the same timeline, but you don't moan and groan over the ankle sprain. I mean, maybe you do, but you accept because you can see the limp and you can feel it and you go, oh yeah, like my ankle's hurt. Obviously I'm going to wait this out. But when it's something you can't see, like a concussion, there's kind of this resistance to it. And I kind of want to talk about why that's a problem here with these three factors. So the three factors are dynamic exercise or exertional tolerance, your reaction time, and your balance as measured, your center of pressure as measured by a force plate. And we're going to break down why those three factors really, really, really matter, starting with dynamic exertion or dynamic exercise tolerance. So dynamic exertion, when you compare it to rest, exerting yourself dynamically means you're not on a stationary bike. You're not on a treadmill. You're not on a rower. You're not doing something steady state. You're doing something dynamic where intensities vary and there's changes in directional movement. There's changes in head position. There's changes in where you're at, like sport. Sport is dynamic exertion. So when we're doing a Buffalo concussion treadmill test, a modified YMCA bike protocol, a Buffalo concussion bike test, one of these exercise tests early in your recovery, that is steady state aerobic. It's not dynamic exertion. And what we see is that compared to rest, dynamic exertion can increase visual and vestibular symptoms. And so this is something we want to see after concussion. We're not going to get that on a Buffalo concussion treadmill test or bike test necessarily all the time, but we will evoke it if it's there in dynamic exertion. And so what we see is that if we're thinking about this 21-day recovery, 21 to 30 days, depending on kind of how your recovery goes, more than 50% of concussion patients are going to flare on dynamic exertion protocols within 30 days. So if you're within that 30-day of your concussion window, so you had a concussion here, within 30 days after that, if we put you through a dynamic exertion protocol anywhere within here, half of you are going to have symptoms that wouldn't be present on the bike test or on the treadmill test or these steady state aerobic conditions. So what we find is that even athletes that pass the entire concussion return to play protocol, all 6 stages, and they're cleared to play, we find that if we give you dynamic exertion, like a real dynamic exertion protocol, you won't pass. You will have concussion symptoms flare back up, which tells me you're actually not ready for sport. Because if you go back to your sport, which is this dynamic exertion situation, you're probably going to have symptoms flare up. I believe it was CCMI, Complete Concussion Management, so Dr. Cameron Marshall and his crew that did a study on the Gapski-Goodman protocol or the Chicago Blackhawks test. And they found that all these athletes that were cleared, about 28% of them when put through this test, so almost 1 in 3 athletes put through an exertion protocol, flared and were actually not ready to play. So when we're just looking at symptoms and we're not even looking at exercise tolerance, or we're just looking at steady state aerobic tolerance, we're missing about 1 in 3 people who are not ready to return, as high as 50% of people not ready to return within that 30 days. So what's my solution here? We want an exertion protocol prior to clearing our athletes before stage 5. So again, parents, coaches, athletes, yourself, before you're cleared for full contact practice, ask your provider or have your provider run you through an exertion protocol. Right now, there's 2 out there, the Gapski-Goodman and the dynamic exertion exit test. And so Chicago Blackhawks or dynamic exit test, those are 2 that you can use before you go to full contact practice. The next thing we're going to talk about is reaction time. So reaction time is something wildly important in sports. It's how you catch a ball. It's how you respond to a play, catch a pass, shoot the puck at the right time. Do these different things is all dependent on your reaction to the environment. And one of the things we can test is your simple reaction time. So there's simple reaction, choice reaction, discriminative reaction. So there's different types of reaction, but all we're saying is stimulus response. How long does that take you? And what we find is that reaction time after a concussion peaks. It's its worst. It's its slowest 3 days after the injury. And we see that deficit can last for 21 to 59 days. So it can last as long as that 21-day concussion recovery plan. So if we're not actually tracking your reaction time before we send you back to sport, you might not have the appropriate reaction time to dodge the hit, to know when to move this way or that way at the appropriate time to prevent another injury, right? So the solution to that is actually testing reaction time at baseline. This is not done in the SCAT-5. This is not tested for in the impact. So you actually have to separately test reaction time as a part of your baseline test so that we know your reaction time, so that after concussion, we can see that, it's actually lower than what you usually perform at. And so that we can see by 21 days, you're back to your reaction time or better. So testing at baseline and return to play reaction time, really, really important. Last thing we're going to talk about is balance. As measured through center of pressure, so standing on a force plate. And this is a required piece of equipment in CCMI certified clinics. This is a piece of equipment you can find in functional neurology clinics. This is a piece of equipment you can find in concussion specialists that are actually doing proper work. And so the reason I say this is center of pressure. So if I'm standing or I'm sitting right now, there's a center of pressure on the chair. And as I lean this way, the center of pressure moves this way. And as I lean that way, the center of pressure moves that way. And so as you're standing on the force plate and your feet are kind of fidgeting to find their position, each little move is a move in your center of pressure. And we'll trace that to calculate how many centimeters did you actually move over this 20 seconds on this leg versus this leg, or in this position versus that position. And so what we find is that center of pressure deficit can last for up to 30 days after the injury. And remember that normal concussion recovery takes 21 days. So if we have a deficit that can be as durable as the entire recovery, we know that if your balance was here before, it's here after, and it returns to here, we know that you're actually better. What we're comparing this to, what we're comparing a force plate center of pressure measure to, is the balance error scoring system. And the balance error scoring system is something you'll do in the SCAT-5. So that's a sideline test that a lot of organizations use. It's a great assessment tool for kind of sideline diagnosis of concussion. It is a terrible tool for return to play decisions. And it's a terrible tool because it will normalize within a week. And that balance test in particular, the balance error scoring system, will normalize within about 3 days. And so within about 3 days of your injury, your balance, just standing here and standing tandem and on one leg, you're going to pass that test, whether you're actually ready to return to play or not. But that center of pressure metric is durable up to a month after the injury. So the solution there, test your balance on a force plate at baseline, so as a preseason baseline test, and use it as a return to play metric. So if your balance is not actually up to par, up to where you were, you're probably not ready to return to play, especially if this is true around dynamic exertion. So if I were to recap everything, the 3 factors that are going to they're going to self-limit your recovery. You are not going to be able to return to play within 7 days if you actually track dynamic exertion, reaction time, and balance as measured by center of pressure on a force plate. And these are not crazy things to measure. Reaction time, we actually measure with a drop stick, or I measure it with my patients through the EQ app, where we can actually, there's a fastball game where it's like, how fast can you just touch the screen after you see the ball pop up on the screen? In office, we use a drop stick. So it'll be a 1 meter dowel with a hockey puck attached to it. And we just see how many centimeters does it take you to catch. And if those metrics are off, we know that you're off and you're not ready to return to play until you're catching it faster, right? Until you're touching the ball faster. When we measure your force plate measure at the beginning of the season, we want to see that you're within where you were at the beginning of the season rather than where you were after the concussion. And with dynamic exertion, we just want to make sure that you can reach these high thresholds, these anaerobic thresholds, that you can twist and turn and look at your hands and do these dynamic things without a flare in these visual, vestibular, autonomic symptoms, so that we know and we feel confident that you are safe to go back out there into an environment where you're going to get hit again. So those are 3 metrics. If you have any questions, I'm going to post the live replay here in a bit. So go ahead and leave those in the comments. Now that this is up, I'm going to link to a couple blogs that I have where if you want references for the things that I just talked about, they're in those blogs. Next week on the 9th, we're going to talk about the other thing I threw up for people to vote on was 3 questions for your doctor in acute concussion visit. So you walk into your doctor and you're like, what the hell do I ask him or her so that I know what to do to optimize my concussion recovery. So this week we talked about the 3 factors for return to play. Next week, we're going to talk about 3 questions to ask your doctor. And then on Monday, I'm going to post 2 new topics that you can kind of vote on for the next couple of weeks. So thank you guys for watching. I will chat with you again next